Hi guys, how are you doing? Dr. Dranjanabhana here and welcome back to my YouTube channel. And today we're doing microneedling and discussing these sort of invasive, well they're not really that invasive, but minimally invasive treatments on skin of color. So we're going to go through that and tell us a bit about yourself, Tipi. So you also are into skin. So you can tell us about how into skin you are. How's my pun? That's pretty good. Eh?
That was a very good
pun.
Yeah, my name is Tipi and I'm the founder of Into Skin, as Dr. Bana has said, which is a platform which is focused on melanin-rich skin, so skin of color, and looking at what we as people of brown and black skin can do for our skins in terms of skincare and treatments and making sure it's safe for us as well. So that's me.
So I just did a super soft cleanse, which will just lightly cleanse the area before we microneedle, and then I'm going to be using a vibrational cleansing device with this very light exfoliation in there and then some lifting movements as well. So you'll feel a light vibration. Just cleansing the face now, and then next I'm going to keep it a bit moist, and then using the same vibrational device just to do some lymph drainage and lifting movements on the skin. Just moistening it a bit. So with the lifting, the vibration isn't like continuous, so you'll feel a bit of vibration every like second or so. Is that okay? So we're doing upward movements because the whole point is to lift, and then on the side of the cheeks we'll drain down to the sides.
Is this like a high frequency?
No, similar to that, similar kind of basically the technology, but I'll actually show you the device afterwards. Ultrasonic, there's ultrasonic pulse. How does it feel?
Quite comfortable. I don't feel anything. I think more than anything it's the sound that it's making that's like a little bit weird, but numb face means can't really feel anything. Yeah.
So first we're going to pop on some Glide. So this is also hyaluronic acid with some zinc in, and once that's needle in, I'm going to put on that super serum that we made for you.
And hyaluronic acid, like Dr. B, everybody's using it, right? Because it's hydration, hydration, hydration. Right?
Yeah.
Yeah.
No, it is. And like a good tip with hyaluronic acid is before applying, you should make sure your skin is moist, because it's a what they call a humectant. It attracts water, absorbs water, so and retains water. So if your skin's a little bit moist when you apply, it retains that moisture onto your skin. And then, Tapiso, your hair is super duper healthy, but I know you also mentioned it to me before. There's a little bit of thinning here, and we were chatting about traction alopecia. So, yeah, so every time you go for needling, you should have your hairline as well.
I mean, what a benefit, right? It's kind of stimulate those hair follicles to grow out more hair and just healthy hair.
Are you feeling okay at this step?
Yeah, and it's like, obviously I'm numb.
Yeah.
It's not as relaxing as Sheetal's kind of cleanse and
Yes.
exfoliation. And that's another thing I think people should know is that when it comes to revitalization and
Yes.
rejuvenation treatments, there are going to be treatments that are uncomfortable, right?
Yeah.
Like there are going to be treatments where you do feel a little bit of discomfort, but it's not a sort of traditional spa treatment where it's all relaxation.
That's the important thing, and this is like medical aesthetics, a lot of it. So with that comes some sort of risks and, well, of course, benefits. And I think we were just talking about this the other day, that it's glamorized. Botox, fillers, all of those things are glamorized on things like Instagram, where it's actually a serious treatment that you have to think about before you do it. And people are doing these sort of treatments at home.
I really don't want to kind of comment really terribly, but I just think that's really dangerous. It's a dangerous practice. I think for brown and black people, I wouldn't suggest anybody trying this at home.
Yeah.
The damage that you can cause to your skin and the result of having it even worse than it was before, that risk is just too high for me. I would rather come to a professional person and know that I'm in safe hands rather than try to do this by yourself at home.
No. And you'll notice I'm going really slowly. So with the Dermapen, you can go fast. You can put the speed up quite high. But with a lot of us, we have an issue around the mouth. Oral hyperpigmentation, often from, now with the mask is making it worse, but that friction of moving our mouths a lot, so we get hyperpigmentation there. So not to go too aggressively or too fast. So just more serum there before I move on to your neck. And Peter, you can tell me if your face is feeling a bit tight or itchy or a bit uncomfortable.
No, not at the moment, actually. Okay. I think, the numbing cream has done its job.
And you can see, because you do have a slight tendency to go red, there is a few red spots. So that's normal. And often when our redness or that inflammation is dissipating, it looks sort of brown, but that's not pigmentation over like day 2 or 3.
Okay, so I should expect a little bit of kind of
redness, dryness, tightness, flaking even sometimes. Okay, I'm going to do your lips at the end.
Okay. What other treatments would you say would complement this? Because I think like a chemical peel is great, and then would you say then wait a few weeks and then complement it with microneedling?
So you can alternate. You can even alternate them safely at 2-week intervals, depending on the aggressiveness of either.
Okay.
Or 4 weeks.
Oh, okay.
And there's some treatments, but your skin has to be like pretty prepped before you do something like this, is where I would never do it the other way around. And I know people do, is where they needle and then they do the peel. There is a protocol we have where we actually do a superficial chemical peel, also aimed at hyperpigmentation, and then we do a needling after that with no numbing but very low setting, just to get into the very top layer of skin.
Okay.
And then like mask and LED light after. So you can do them together, but yeah, your skin has to be in a good place, and you have to be really good with your sunscreen before doing that.
Okay. And then just a question for those with acne, especially like live acne. You wouldn't needle inflamed skin that's still got sort of, pustules and things like that, right?
You shouldn't, but there's a setting on this that goes very high, like very fast, and supposedly it oxygenates the skin, but I still would not needle in very inflamed, pustular skin. I mean, you could spread it, you could irritate it.
Now let's also do a controversial
Oh gosh, yes, yes.
me, because I'm allowed to.
Yes.
At-home microneedling that is so popular, you see it
Yeah.
on so many social media platforms. Should people be at-home microneedling?
Yes and no. So so there is, if you can guarantee that you use like an aseptic technique, you can maybe do like a 0.2, which is just into the epidermis for product penetration or for mild stimulation, but that is it. And you have to be really good with disinfecting your device and throwing it away when it needs to be thrown away, especially like maybe the rollers. But otherwise, other than that, like doing something like this at home is a no-no, unless you are a doctor with this pen or an esthetician with this particular type of pen, or there's skin pen, there's some other FDA approved, I think it's InnoPen, like a good quality pens if you are a professional, but I wouldn't do it at home because you in wherever the bathroom or there's pets around, and where do you, I don't know, I just don't think it's safe. And you can, it might seem easy, and I know people do it and maybe they think nothing happens to them, but like I said, I actually said it on a previous video, you can get systemic issues from microneedling incorrectly and microneedling the incorrect things in. Yeah. And also, I mean, if something happens, some sort of like side effect or complication, what do you do? Who do you, like if you go to a professional and someone who is truly a professional, if some sort of issue does arise from this treatment, which can happen, you will get help, you'll get professional assistance.
Yeah, because they've been trained to actually heal if something happens like that. So they know it is this kind of concern, and so this is what we need to do to actually sort of heal that issue. But you're right, I mean, if you're at home, you kind of are like
stuck there by yourself. And also, I mean, you must also be careful where you go, even if it's not at home. So look at who you're going to, because we have had a few people that have gone to a particular place, and whoever's doing it is not an esthetician or a somatologist or someone qualified to do it, or a doctor, and it's someone that also bought just a pen online and has like got a business, and if an infection arises, you're permanently scarred from that. I mean, PIH from that is very difficult to get rid of. It takes years of treatment elsewhere. So also, if you're going somewhere, just make sure it's the right somewhere. Feel okay? Spritz you to pieces so you'll feel like a cool spritz. Probably feel much better, because I'm sure, because your skin is red a little bit, so it'll.
It was uncomfortable.
Oh, so good. So it means you were very numb. And also, we didn't massacre the skin. So I mean, you see, it's already red, and I wouldn't want to irritate the skin further like this, because then there is the risk of hyperpigmentation post treatment. So this is white willow bark, glutathione, niacinamide.
Brightening, right?
Brightening, calming, brightening and calming, which is what you want.
Yeah.
And incredibly hydrating. and it's very cool. So when I put it on, you'll be like, oh, why? But it's very, very calming after a treatment like this. To cover your eyes, so you can feel the cold, but it's nice. It's nice.
It's a nice cooling, like something putting
like a sorbet on your face.
Yeah, from the fridge. Like just
Oh, this actually smells like sorbet. It looks like sorbet, like a pellet cleanser. Well, like it does. Pisa, I know you can't respond to me, but I'm going to put the LED on for you now, and you can just relax. So we've got the LED on. It's on a cycle, which is 7 colors. If specifically you want to address breakouts, active breakouts, blue and hyperpigmentation, green, collagen production, red, but this is a nice cycle, so you'll get all the benefits. Sure you can feel your skin's really cooled off.
yeah, it is. Just really feeling soothed. So
I'm gonna put on something called phytocorrective mask. It's a botanical mask from SkinCeuticals, and then I'm gonna put fast skin repair. Then yeah, what are you using at home now, Tipisa? If you can just
like a really hydrating moisturizer. So it's got niacinamide.
Yeah. Yes.
It's got vitamin B5, which is the panthenol.
Yes, yes.
It's got good old glycerine, because we, the underrated glycerine. So it's like a really hydrating moisturizer. And
Okay.
then a tinted sunscreen for sure every single day.
Yes.
Just to protect the skin. And also, if you're fighting hyperpigmentation, I think you need the sunscreen. You cannot do without it. And in the evenings, what I love, I've got your retinol.
Oh yes. Okay. Oh yes.
I've been using Dr. B's retinol in the evenings, and then a moisturizer over that as well, because I just love that combination. And that's just like really improved my skin. So,
Oh, thank you. So we have our own brand. It is a really nice retinol. It's got ceramides and niacinamide in it as well that work really well together. And it's especially if you're not ready for a prescription tretinoin, and if you maybe want to alternate and still have the benefit of a retinol. But I'd say after this, even though it is nourishing with the ceramides, no retinol for like 3 or 4 days.
okay, just
Yeah.
that hydrating moisturizer.
Yeah.
Okay.
And I think what I'll do is I'll give you some Hyalceutic and Regenceutic to take home just in case.
I just think aftercare is also part of
Yeah.
that process.
Thank you for saying that. Yes, yes, very important. Thank you. Thank you for joining us, guys. It was a really fun session. I really enjoyed it. And if you have any questions about treatments for skin of color, you can drop it in the comments, and you can go check out Into Skin also on Instagram, right?
Yes,
Into
on Instagram, INTUSKIN, Into Skin.
Yes. So go check them out, ask them some questions, ask us some questions, and if you enjoyed this, please like, share, and subscribe. Thank you. Bye-bye.